The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Hello and welcome to my program, Purpose-Driven Aging, where we delve into the realities of aging and uncover the keys to a purpose-driven life. I'm your host, Kathy Heery. I've been an RN for over 40 years. Prior to this, I was an elder care business owner and ran a geriatric care management practice for 20 years. I'm now a writer and producer of educational programs that help you with your aging experiences. All of us are aging, so we all have aging experiences. Hi there, it's Kathy. As your host each month, we focus on different aspects, different things about getting older. In my first video, I looked at the 10 domains of aging, and one of those was the medical domain, which is different from health. We looked at the differences a couple of programs ago. Today, we're going to look at prescription drug management, mismanagement, problems, errors, and what happens specifically during transitions of care. What is a transition of care? Coming home from the hospital, going to a rehab, having a new diagnosis, a procedure. There are multiple definitions. So what we're going to do is look at the top problems. And specifically, we're going to look at your personal medication management, what you can do, how you can set it up, following instructions. Then monitoring side effects. Every medication has a side effect. The more you take, the more the chance to interact with other meds. Cost, this is a big one. It hit me recently, and boy, I'm all fired up as I was telling Grace about that one. Yes. And then some resources you can use for this in your community and as you are either in the hospital or leaving the hospital. So with me today is Grace Dotson. Grace is an RN, registered nurse with more than 40 years experience. She has a strong background in program development aimed at enhancing health outcomes through clinical integration and patient advocacy. Grace earned her bachelor's degree in nursing at Excelsior College and a master's degree in health systems administration from Sage Graduate School in Albany, New York. Grace has held leadership positions in case management with large academic medical centers, community hospital, and has been instrumental in advancing collaborative process improvement projects at the national and the state and the local level. So I'd like to welcome you, Grace, as we kind of walk through these challenges.
Thank you.
So we're going to do three. So the first challenge is organizing, managing, and following medication instructions, the hardest thing to do for so many people. Medication errors often happen during care transitions because what I was taking at home, what I'm taking now, and everything kind of gets mixed up. So something gets forgotten, something gets doubled up, or there's the wrong type of dosing. I mean, there's so many errors that can happen. It's during these transitions that the details about how you manage your meds and what you really need. A lot of people are afraid to ask for help, afraid to let us know that maybe I can't read this, maybe I don't understand it for fear of looking stupid. But, the whole idea is to get a system, whatever it is, and no one system is the best. So, Grace, I'd like to ask you if you could give us some ideas on organizing and managing meds during these transitions, usually to home, but it could be in between care situations.
Yes, certainly. I would encourage people to look at the pharmacist as a partner with your medications and take advantage of that opportunity for consultation. Talk with your doctor and your nurses as well as if you're leaving the hospital. Make sure you have a caregiver with you who's also listening to instructions. Many times when people are transitioning from hospital to home, they are not listening. They are focused on getting home, getting in the car, seeing their pets, and they may not absorb all the information. It's always good to have a second set of ears, if possible, and to ask questions at that point.
And I know that one of the things that comes up about schedules, one of the most effective methods that I saw in terms of being discharged from, hospital to home, is having just a visual schedule.
Yes.
Something written out. So morning, afternoon, evening, bedtime,
Yes.
before meals, after meals, and actually writing it out before I make the move from one setting to another. Can you talk about how you do that?
Yeah, absolutely.
In your experience?
And the use of pillboxes, very, very helpful. And keeping those pillboxes and those instructions in the same place. So you have a routine. Many times when there are transitions in care, and that could include a disruption in your daily schedule. You have company coming, you move things, or you're transitioning from one place to another. You may get out of a routine, if you will. So keeping a routine, setting alarms. If you have a smartphone, set an alarm as a reminder to take your medications. But very important to use the tools that are available.
You know, I know the pill organizer, you know, I've had people say to me, I'm not old enough to need that yet, and they're in their 90s. And I think that, you know, I use one now, and I don't take that many meds at this time, but I can tell you, having been through a family member's recent illness over a period of time, you know, it was very easy, even though it was set up, and everything was set up correctly, the person was so medicated or felt so sick that the person would double up. So it's almost like you need to set it up, and they need to take it one dose at a time rather than for the week. So it matters on what the condition is of the person too. And the other thing is about creating a dedicated space. Can you talk about some meds that need to be cooled, heated, refrigerated?
That's correct. There are, you know, certain antibiotics, for example, and it's important to read the instructions that come home, you know, from the hospital with you or from the pharmacy. That insert, read those instructions and read about potential side effects and how to keep the medications. Some medications may require refrigeration, or keep them in a dark cabinet and not exposed to sunlight, or keep yourself out of sunlight to prevent sunburns. So it's important to read all of that information and to understand it.
Yeah, I know that, you know, people who are getting, say, chemotherapy, for example, they're getting chemotherapy in a hospital or in an outpatient setting, and yet that staying out of the sunlight is critically important. Also, the food-to-food interactions. So how do we just simplify this on our end, you know, to make it easy to use? In a difference to organizations, you mentioned routine. You know, I know I used to travel a lot, and I used to keep two different bags of meds, you know, so I could just grab one. And you would mention something that that you got out of your routine at one point.
Yes, actually, I have a medication that I need to take on an empty stomach early in the morning. So I keep that in a drawer with my toothbrush. And we had traveled recently, so I had my pill box with me. And to save space, I just put that medication that's normally in the drawer in the pill box.
Yeah.
When we returned home, you know, you focused on unpacking and getting back to your routine at home. Of course, what did I do? I took from the pill box, but in there was that medicine that was in the drawer. I also was taking the medicine that was in the drawer. So I was double dosing on something. And I realized that after 2 days, like, why am I so sleepy?
And you know, it's interesting because we know a little bit about medication management. It can happen to us, it can happen to anybody.
Absolutely.
You know, you think you've set something up appropriately, and then you found the person's, you know, eaten the whole nighttime dose before rather than take it in the morning. And some of these medications may be time released. So you don't want to take it because you can overdose if they're taken wrong. So the resources that are available here are, you know, the people that are in the facility. And if you don't understand, speak up. You know, as someone, both of us have been on that end, and we don't see this as someone who's crazy or, you know, uneducated. We see this as, wow, somebody who's involved. You know, the chance of reducing errors here goes way up. And there are many different ways to present this information. So in terms of reading the labels too, I know people have said, oh God, they're so small. Sometimes you can get the bigger print. So it's important to ask for it when you're getting your medications. Another resource is the internet. For me, I just go, oh my God, I can't bother with this small print. The font is like 2.
Yeah.
So, I'll go on the internet and I'll pull it up and I'll read, on some of the websites that I know, the good, the bad, and the ugly. And then I know what questions to have. And then finally, I think, I'll let you sum up before we move on to the next area, is that carry a list of medications with you.
Yes.
To every appointment, every physician appointment, dental appointment, whether you're outpatient, whether you think they have the information, they don't. Your medication list is a fluid and changing instrument.
I was going to say, also, some people don't have children in the home, so talk to your pharmacist. If you're having trouble opening these safety caps that lock, they can give you a different type of top for your medications. It makes it a little bit easier if you have arthritis in your hands, for example.
Oh, yeah, that's a good point. Absolutely.
But I wanted to mention bias and that point of education on medications and the hesitancy sometimes of the patient who's receiving the information or is not receptive to the information, as well as the person who's doing the education. We have to, as caregivers, remember bias. Because Mr. Jones, who is a retired school teacher, who we know he has his master's degree and he's kind of gruff and he's not very receptive to the information. Is he really absorbing the information, or are we assuming, oh, he'll read it, he has his master's? We need to be keyed into that. If somebody, another patient, for example, is saying, I can't read that, I don't have my glasses, can you go over that? Be sensitive. It could be they have literacy problems and they can't read. And so the use of videos, the use of verbally walking through scenarios with patients and explaining to them about the medications and maybe they need to avoid grapefruit juice. Things like that are very important. And again, pull in that caregiver. Instead of parking the car, pull in the caregiver to that very important information.
And know that resources are available down the trail. That's important too. So one of the other things that comes up, the second reason that we see a lot of errors in the transitions of care is managing adverse reactions. So you look at so many people, chronic conditions are the primary drivers of hospitalizations right now. Someone's been going along fine and then they have a problem or a new problem develops. Each new problem, each existing problem has its own dedicated medication and its own dedicated specialist. We have more ologists, the neurologist, the cardiologist, the pulmonologist, the rheumatologist. I mean, you can just go on and on with this. And each person ends up prescribing more medications and you find yourself on more and more. So what does that do? That increases the chance of adverse reactions. So in your experience, how would you advise people what to look for and how to, manage, especially when starting a new med where they may not understand what it's going to feel like?
Yes. And there's a term, polypharmacy, where somebody is on multiple medications and those medications can interact. So, patients and people who are taking medications need to be aware that if they're developing symptoms that indicate an allergy, a rash that's new, they're having problems with excessive lethargy, they're very tired, or maybe their heart rate is up or feels like it's going down, contact the physician and don't wait, act on that pretty quickly.
Yeah, I know that, one of the things that, we always did, or I always told my clients to do is to keep a journal. Because sometimes the things are very subtle. I was sleeping fine and now I'm not sleeping fine. I'm being woken in the middle of the night. People who go on new diuretics, which are water pills and things, if they're not taken at the right time of day, they're up all night and you probably use in the bathroom. Mm-hmm. And then you have blood pressure, as Grace was mentioning, or inhalers or certain medications that have to be taken at the time of day. It might not be the best time of day for you.
Yes.
So just keep track of what exactly is feeling, because it's those vague symptoms that are difficult to tease out without more information.
Absolutely.
So having your, what's the word I'm looking for, the drug, your list of drugs, but also the time of day you're taking them.
Yes.
It can be as simple as that. I know there are a lot of fancy-dancy, applications that people can, I take my med at this time, and this time, and that's fine. But for older people, they don't use that a lot. So what are your thoughts in terms of using a pharmacist or one pharmacy, or people who use mail order pharmacies and others looking at drug-to-drug interactions?
Yeah, so that's another point that could possibly pose a problem. If you're getting medication in the mail and you're also going to the local pharmacy, and perhaps you're leaving the hospital and you're getting medication from their pharmacy, you may end up with multiple medications, different names. It could be a brand name, a generic name, but it's all the same medicine, and end up with overdosing on a medication. So it's important, ideally, to stick with one pharmacy if you can. And I also wanted to mention from personal experience, if you are traveling and you have forgotten to bring your medicines with you, say you get your medicines through a big chain pharmacy like CVS or Walgreens, give that local one where you're staying a call, and they can look in the computer and possibly fill your prescription or give you enough for a few days to get you covered until you get back home. And this, again, came up recently, and my husband was quite surprised and quite pleased that they were able to do that. But they are able to do that.
Yeah, you try every little trick. Yes. Absolutely.
Yeah.
And one other caveat here before we move on to our third challenge is that the same medication can come in different forms. And I saw this over the years with things like morphine. There's extended release. There is different dosages. So sometimes to save money, the dosage will change. So you might be taking 5 milligrams and they send you 15 milligrams in a scored tablet because the dose is increased to 7.5. Well, the person doesn't know that, doesn't keep track of that. And the next thing you know, their breathing is so low because they've overdosed. And it's unintentional. But that's just one example that I've been through. So as we move into, speaking of cost, is the final, and one that's probably most near and dear to so many people's hearts, is the cost of medications. So financial concerns, the ability to afford medications, is the number one problem. As a matter of fact, 25% of people cannot afford their medications, with or without insurance. So I know there's a lot of activity on Capitol Hill, as a matter of fact, this week, looking at the cost of some common drugs. So it's on the radar of many, but it never seems to get to any resolution. And, I know that my most recent trip to the pharmacy added an extra $400 or $500 a month for a new script, needless to say. We're doing a workaround on that one. But it's an issue for so many people with errors. They either don't fill them, or they don't take them correctly, or they split in half to save money on their end. So can you talk a little bit about what you find at discharge when people, come and they may be going home on meds, or how they can access meds if they can't afford them?
Sure. I think it's important for the provider who's doing the education, number one, to use return demonstration so that if they're teaching a technique to somebody, they are seeing that person actually handle, for example, a syringe, or verbally tell them, this is how I will take this medicine, so that you can be assured they're going to do it correctly. You hope they will be able to do that. But the cost of medications, it's important to talk about, do you have prescription coverage? What type of prescription coverage do you have? And some people don't have insurance, and they may benefit from a program like GoodRx, where they can get the medications maybe at a slightly reduced cost. But out-of-pocket cost, even for people who are insured, can be quite high. And people coming back to the hospital after a hospital admission as a readmission within 30 days, almost half of those admissions are related to medications. Either they didn't fill the prescription, they were cutting corners because of the cost of the medications, and they didn't take it as was prescribed, or they're overdosing. They're making a mistake and they're taking too much of a medication and they're coming right back to the hospital. So with good education and reinforcement of that education, that rate, instead of being 50%, actually goes down to about 8%, which is significant.
Yeah, I think that, the cost of medications, you look at things like Wegovy, what's the other one? Ozempic, some of the newer ones, you turn on your TV, right? And it's just ask your doctor. Yeah, well, it's no problem getting it prescribed. The problem comes with getting it paid for. Yes. So you look at the cost of these anti-obesity drugs or whatever they're called. They're really diabetic drugs, but initially, but they're being marketed and promoted on, under a different usage. And when it's popular, then the price can go up. So one of the reasons the prices are so expensive in this country is there's no negotiation of prescription drugs. We're the only country. And most of the money is made here in the United States by the pharmaceutical companies. So you're looking at $1,300 to $1,500 a month. Who can afford that? You go to GoodRx, as Grace mentioned, and it might take 20 to 25% off of that. And, you look at the way to do this is you can look at the retail cost online of what this is. And then you look up these, we'll get into some resources in a bit, and you can compare and find out what may work for you, especially if you're uninsured. The other thing is looking at your insurance options. People that you mentioned were uninsured.
Yes.
Can you help get them on Medicaid, or at this time when they're being discharged, maybe they're just being identified for the first time and they have no idea what's available for them?
So oftentimes from the hospital setting, because that's acute care and it's a short stay usually, they're often referring people out to community agencies to help people apply for Medicaid programs if they're eligible. But there are folks in the business office at the hospital who can do a quick look at the financial picture of the patient to see, will they qualify?
Yeah.
So that's important too. Not everybody qualifies for these programs.
And can you talk about the patient assistance programs that the hospital has for some of these high expensive drugs, like say a new cancer diagnosis and they're being put on something that could be $20,000 or $15,000?
Yes. There are programs available, and usually hospitals will have staff in the pharmacy who are dedicated to helping people who need that assistance. And you apply. It's almost like applying for a grant, but it's a program that will bring the cost of that medication down to a very reasonable cost or even free.
Yeah.
And those are great programs to take
And how do people
advantage of.
access that in the hospital?
They, oftentimes it's a nurse case manager or a social worker who's working on the discharge plan with the patient and family who will start that consultation to a pharmacist who specializes in helping patients with that type of program. But you can ask. I mean, you can ask.
Yeah. Well, while we're on this discussion, we can go right into the other resources that might be available for people, whether or not it's having issues with organizing, managing your meds, or how to track interactions, or how to afford what you can do. So the patient assistance programs that Grace mentioned are great ones because you can, and sometimes it takes a little while, but there are forms, and it's income driven, isn't it?
It is, and sometimes it's a 30-day dose, if you will. It may not go beyond that, but there are programs available, but sometimes there is some paperwork involved and providing information. It may not happen immediately that the coverage is there. So that's another thing to consider.
In some of the community agencies, like area agencies on aging, such as like in this area, it's Bristol Elder Services or Old Colony Elder Services or HESCO Elder Services, depending on where you live. And these organizations are great for coming in and looking at your needs and then being able to level you in terms of what you may be available to receive in the community for assistance with medication management. Along that road too is Shine counselors That's what they're called in Massachusetts.
Yes.
In other states, they're SHIP. These are people who are definitely, especially now as we enter open enrollment October 15th, to be able to help you look at your current plans and see if anything can be done to change, or if you're new or you never enrolled when you needed to. These are great resources in the community. So discount cards, you talked a little bit about that. Have you worked with patients to help them get, or people, individuals, helping them or referring them or to get set up?
A bit, but usually, again, we're directing them to a pharmacist or a pharmacy program who then has, a lot more information on the resources available and can look into which one is the best fit for the patient.
And you can even do that online. You can put in, like we talked about, Wegovy or Ozempic, just put it in online on the GoodRx site, and it'll bring up the different pharmacies in the different areas, from Costco to CVS to others, and what they'd charge for price or what the discount could be. So it's worth it. Sometimes it isn't that much, but you have to compare it to what you have for drug coverage. If you don't have coverage, then that could be a problem.
Yes.
Because 20% of the full retail cost in some of these meds, especially, one night, what does this say, right? So I was sitting there writing down all the drug commercials, and I was looking up what the retail cost was of all these commercials. They never tell you the cost, right? And they go from anywhere from $5,000 to $10,000 a month, some of these. And if you have insurance, it might get them down, but even $300, $400, $500 extra a month. So one of the other things in Massachusetts we have available is Prescription Advantage, which is a program that is available at the state level. Every state has its own state pharmacy assistance program. You're probably familiar with this. And, that's income-driven, not asset-driven. So you can look that up online at Prescription Advantage. And then, in terms of, people who come into the hospital with a lot of medications and then go home with a lot of new medications, what's the process for reconciling those at discharge?
It's usually the physician who is charged with doing a reconciliation as the patient comes into the hospital, and then again at discharge. So they're comparing the home medications, what the patient has provided as far as a list. So it's really important, as you said, bring a list with you, or sometimes bring a bag of medications, which may need to get locked up, but bring that with you so that there is a good understanding of what you're taking. And that includes medicines that may be in a shoebox under the bed. Oftentimes, folks who are going into the home to visit and do reinforcement of that patient teaching that was done in the hospital setting, find all kinds of things in the home setting, in the shoebox, in the back of the cabinet. Oh yeah, I'm taking this. Oh, this is a supplement. This is a vitamin. This is, my friend gave me this. So yeah, important to list all of those medications.
Absolutely. And finally, in getting ready to close out here, I just want to remind people that it's open enrollment season for people on Medicare. It starts October 15th. Look in the mail for your annual notice of change. There's been changes to the prescription drug benefit. Many of you will go, yay, $2,000 cap, but the reality is, look at your premiums, look to see if your drugs are still included, and look at which tier they're on and how expensive it's going to be to stay on that med, and make the changes that you may need to make. The other thing is, you don't always have to use your insurance. If you can get it cheaper using a discount, don't use your insurance. So I'd like to thank Grace for her time today in this really needed discussion. I think we may get into other discussions in this area. So purpose-driven aging, this program isn't just about growing older. It's about living each day and making a difference in the world. It encourages all of us to approach life with a sense of purpose, passion, and intention. So we'll see you next month as we continue to focus on topics that are important to you, to help you and yourself. So until then, take care and embrace your journey as you age. Thank you.